I want to bring in Dr. Payal Patel. She's an infectious diseases physician at the University of Michigan Medical School. So vaccine appointments, they've been very hard to get in major cities like New York and San Francisco. Are there other measures people can take to reduce the spread?
Yeah, definitely. I think that prevention is going to be really key in trying to keep our numbers down. And the way I would think about that is really, if you have been exposed or think that you may be exposed, definitely getting a vaccine is a top priority. On top of that, trying to minimize skin to skin contact with folks where you may or may not know if they have monkeypox. That's going to be really important now as we continue to see more and more cases, not only in the US, but really internationally as well.
So as a practical question, how much exposure do you need to have in order to contract the virus?
Yeah, that's a great question. So, we've really been advising people things like hugging, kissing, really even sharing the same bed, sharing towels. This is something where it's close contact. So it could be someone staying in the same house as you. It could be, sharing a close moment over time. Usually we've seen it's more hours. So it's 2 to 3 hours minimally to really get something like this, which compared to COVID, we know that it was, as little time as 15 minutes. So it is different, but I think that we need to be thinking about that, and the public needs to be aware of that as we're seeing more cases.
Okay, so how severe are these infections, and what are the kind of symptoms that people should be looking for?
Yeah, we had a really interesting case report come out of England that really followed all of the cases that they've been seeing in the United Kingdom. And they said that very similar to what we've seen in the past with monkeypox, most people, almost all people in this research did have a rash. Many people had a fever. What's new is that sometimes the lesions are in the genital area. People will have penile swelling, rectal pain. These are things that we didn't normally think of with monkeypox. So it's really important for both patients as well as doctors to be thinking about monkeypox if someone presents with these things. And again, if you have a fever and a new rash, that is a really good time to get in touch with your doctor.
If you get monkeypox, can you clear it without a lot of consequences, or can there be long-term damage to a patient's health?
Yes, I think that what we're seeing is, right now, people who do have this infection, it is a tough time. It's usually a couple of weeks that people will have these symptoms, and it's not easy. The good news is that most people will come out of this without having those long-term symptoms, which is great. But like most viral infections, there is always a chance that you could have some long-term consequences. So the best way is prevention, and that's what I would put my money on.
The first case of monkeypox has been discovered in the U.S. prison system. How concerning is that to you? What's the risk of spread in a setting like that?
Yeah, hearing that as an infectious disease physician, one thing that really strikes me and I think is going to be very hard is that once we find a case, what we're advising patients right now is that they're really infectious for up to 3 weeks. So
3 weeks?
About something
Wow.
like, yes.
3 weeks.
Exactly. And so, thinking about a system where you don't have that much room, that is going to be one of the hardest things. How do we keep infection control so that we can try to prevent the spread? And I am very worried about people in enclosed spaces and how this is going to spread without good isolation.
Dr. Payal Patel, thank you.
Thank you.